He's a dietitian. Okay.
Okay, we are rolling, guys.
All right, well, I will bypass the niceties. You're getting a peg tube. Okay, so this is the tube feeding instruction for home booklet. And if you turn on page 3 of the booklet, it has a picture of what we're going to go on and over. There you go. So generally I show people the picture and I say, so you're going to have this little tube come out of your stomach right here. It's kind of close to your belly button, depending on your physiology. And the tube won't come out because there's a little button per se. And then I show them this is what you have, that's that little button that comes out, and then this part comes out of your stomach. And the way they do this is they go about, you're going to have a surgical procedure, and if you turn on to page, the next, I went too fast. There. This is all about what to expect in the surgical procedure, and it goes over and it shows you, do you want that information too? About going, you're going to go.
Page 5.
Oh yeah, on page 5. You're going to receive anesthesia, and basically they're going to pass this scope down your throat, and this will be attached to it down your food pipe, okay, into your stomach. And then they make a little incision and pull this all the way through. So now you can't see this. This is in your stomach. And then they they're able to attach this part to it. See, I don't have the real, this is the real thing, but see how these kind of attach right here. Okay. So then you have this part in your stomach. Now this is the part that you want to really become familiar with, because this is where you come into play. So this part, this is a little disc, and that was in your picture too on page 3. This will come out of your stomach, this little incision right here. And you have a port. And again, you're going to be feeding yourself with a syringe into this little port. Now, just some other things about when you after you have your procedure, I just want to mention here, it is going to be a little tender and sore, and that's really normal. And you also want to make sure the surgeon goes over with you, or the nurse, your cleaning and caring of the site. Each surgeon's a little bit different. We just want to make sure we're all on board the same path. Showering and bathing, and when you can start using your peg tube. Okay, some people will start using it right away. You, on the other hand, can still eat right now, so we're just going to be flushing your tube. All right. Some other things that we need to work on that you need before you leave is materials for dressing care. And this is what we're working on.
To get standard.
Yeah, standard care. So I would ask the nurse at the surgery center to give you some split dressings. It's listed right here.
Okay.
And also a syringe. And the syringe looks like this. So it's just a big 60 milliliter syringe. Okay, so if you don't get those right away, you can ask your medical oncologist or your radiation oncologist nurse. That's what I would do. The second part is, where do you get the formula that actually goes into the tube, the nutrition to feed you? That comes from a place called Humboldt Home Infusion. And they also will give you the supplies, the feeding syringe, and the dressing changes. And they'll give you a little cup and a tube, and you'll get your formula, and it comes in boxes like this. Okay, so this particular one is called FiberSource. There's a lot of different ones out there based on your needs. But we're going to go over on how to do that in a minute, but let's just go. So this formula and these materials also come from Home Infusion, and I did put their information down. Did I not put their number down here? Oh, I did. Oh, we should put their address. We put their address, but we never put their phone number in there.
Okay. So our booklets need your phone number.
Yeah, we need to put a phone number in there. But that is where that comes from, and it also has to, I go over and tell them it needs to be authorized by insurance, and sometimes that doesn't happen right away, but we'll work with them as much as possible to get your formula to you right away.
So I'll have that
That would be the ultimate plan if you would have it before, but likely what's gonna happen is it's gonna come after. Especially for you, you don't need to use it right away, your formula. Somebody will be keeping track of you. Okay, next page. Here. So this is just goes over a tracheostomy tube, which you are not having. This is a different kind of feeding tube. But this is the important part I want to go over here about caring for your skin around your PEG tube. And like I said, it's going to be a little tender. Now, if you see a lot of drainage, if it's really green and odor, it has a bad odor to it, right away you want to call the surgeon and say something, you know, tell them what's going on. That's not a good sign. But it's normal to have a little green drainage and not to have much odor at all. And in your tube, it's really normal to see gastric juices as well. So that's okay. That's totally normal.
What color are they?
They can be sometimes just a clear, even up to off-whitish color. Yeah, good question. And then around the dressing change, you're gonna get these things called split dressings. So they have a little split in there. So you've got this, and this part, remember, is inside your stomach, so you don't see that. And you've got the disc right against your skin. And what happens is you get these little pads put up on each side, so they totally cover. And right now I'm able to lift it, but you just have to wedge it in there. And then some people feel comfortable with a little bit of tape to kind of keep it down on each side, but not necessarily needed, especially after the first couple weeks. And if it's healing really nice, you can actually not even use those things in a couple weeks. You can have it just like that. But generally what you want to do, and each surgeon's a little different, like I said, is you want to make sure that you're cleaning it with a little wet Q-tip. It can be a little soapy water if you want, and just kind of go around with the Q-tip and clean it, and then use another dry Q-tip and just dry it off. And just look for redness or any irritation. And if you notice anything, tell the med-onc or the rad-onc nurse that you're working with.
Okay.
And like I said, those are all in these steps right here. As far as taking a shower, again, usually it's about a week after, and I think that's on the next page about taking a shower and a bath, bathing right here. You should always not face away from the shower. Don't let the shower head hit your new incision, but turn the other way. And then bathing, usually it's about 6 weeks, but again, ask your surgeon. Okay. Any questions so far? That's on this care of it.
No.
Okay, so now we're gonna get into how to actually give yourself some nutrition. This page here is actually gonna be your feeding schedule. It's gonna have the name of the product, the amount you use, your calories and protein that you'll get. Most people do this feeding, it's called bolus. And another name for that is also syringe. It just means you're gonna use the syringe and bolus your nutrition formula all at once. There's different ways to get in your nutrition. If that doesn't work out for you, we can try something called gravity feed. If that doesn't work out for you, we can do something called using a pump. So don't get upset when, just let me know that that's actually happening so I can help you. Before and after, and I have to tell you, Linda, I always use this, water sandwich.
Okay.
That's a good term, people like that. You always want to do something called a water sandwich, so before you give your formula, you're always going to do water through this tube. Water, formula, water. This will prevent it from clogging and making sure that it's running and everything's going through efficiently.
What temperature should the water be?
Oh, good question. And this is on the next page too, is everything, your formula and your water should be at room temperature. Definitely. So if you do have a half of a can that maybe, or a half of a box you've used, just keep it out for, and put it in the fridge and then keep it out for about 30 minutes before you use it again. That's a good question. This is if you decide, cycling is something you do if you decide to use gravity or the pump. So that's just an extra sheet, but here is where I really want to focus on. is making sure you're washing your hands really well. Everything should be as clean as it can be before you start, so you don't increase your risk of an infection. And then you have, I just want to make sure I'm on the same, using all the same language that's on here. Okay, so in here it says cans, but we used to be called cans. Sometimes you'll still get cans or boxes. Shake it really well. It does say it's at room temperature. And then throw away anything that's been left out for more than 24 hours. And that's in here too. You've got your syringe. You can reuse these. Just make sure you have a place in your kitchen that you're just using, maybe soapy, a little bowl with soap and water to wash these, and then its own drying area. You're gonna need your tap water. Lukewarm tap water is fine, and you can use your little container that your syringe came with, or a clean glass. A feeding bag, again, you might get to be using a feeding bag if you need to be on the pump. You will get your formula and it will look like this in a bag. Okay, but this is just to show you there are other options out there for you. So if the bolus syringe method isn't working. Number 3, and the picture shows you on here, is make sure that you are sitting up when you do this, or at least have 3 to 4 pillows. So you're at the 30 to 45 degrees if you have to lay down. That way you're not getting any kind of reflux and you have better digestion of everything. Okay, so the next page is how do we actually do this? There's 2 ways to syringe in. And the first way, most people, step A is really good, way people like it, is you just open this up, and you're also gonna have something called a clamp, although I found that some surgeons forget to put them on. And so if they did forget to put a clamp on, instruct them just to pinch the tubing before they open it. This way it will prevent any kind of liquid that's in there from spurting out. So pinch or clamp, open, make the connection with the syringe, then you can unpinch or unclamp. So it's a little bit of a, now the thing I didn't do before I did this is remove the plunger from the syringe. So you can either just go like this and pour it right in. And you let gravity do its business and it will go down nice and easy. A lot of people, this particular educational tube doesn't show, a lot of people have about a 8 to 12 inch tube coming from your stomach. The other way that you can do this if you find that kind of uncomfortable is you can take your box, this, pour your tube feeding in here, so you've got it in there, and then you're just gonna plunge it up, syringe it up. So you've got your syringe all the way down, you put it in, pull it all the way up till the top, and now you're gonna do the same exact thing. You're gonna have your tube pinched or clamped. Oh, this is not gonna be open. Then you're gonna open, make the connection, unclamp, and slowly use this to the syringe. It should be really slow. Now if you go fast like this, cramping, nausea, bloating, even vomiting. So just take it easy when you do that. After you've given your formula, what was I supposed to do before I started my formula?
Flush.
With what?
Lukewarm water.
You got it. Now I'm all done, so I can do that again. I can just use the same thing that my formula was in, and I can just take if I want to take a cup, do the 60 milliliters of water. Now some people are going to need more water depending on how much formula you need. So it might be that you're giving yourself 2 syringes of water. So any questions with that? So you do water, formula, water, and then you recap everything, wash everything really well, and you're good to go. The other part is, do not lay, remember you're at 3 to 4 pillows, you're not laying down. Don't eat anything for another 2 to 3 hours if you can still eat right now. So don't do this and then eat right away because your stomach will get too full.
Okay.
So you have to wait a little bit for that. Other things that can go on with this is on page 15, is that your mouth, if you're just solely on your peg feedings, sometimes people forget to take care of their mouth. So make sure you're still brushing your teeth. With the radiation, you can get, that mucus can get really ropey in there, it's called, and thick. So using a little teaspoon of salt in a cup of water and gargling that several times a day can help. Medications, if you're having a hard time with your medications, swallowing those, we'll work with the pharmacist and we'll see which ones we can crush or which ones can be liquid. Some patients are really good about just doing that themselves. Some patients want me to do that for them. But it's gonna be the same thing. You're gonna you're gonna flush before with water, and then you can crush your medication if it's okay in about 30 to 60 milliliters of water, and you'll do the same thing. You'll just pour it on through. And then what do you do after you give your medication?
Flush.
With water. You got it.
Pill sandwich.
That's right. Pill sandwich. And then again, wash your hands really well. Let's see.
Question,
Yeah.
Jenny, can any of the equipment go in the dishwasher, or do you recommend hand washing?
Yeah, I just recommend hand washing because I think
And after every single feeding.
after every feeding, because you don't want any of that residual on there and get bacteria building up or anything. Other things that can happen, sometimes diarrhea can happen. This can be because you gave your formula too fast, it was not room temperature. And also just make sure you're washing your hands really good. Poor hygiene can be an issue. And some of the tube feeding formulas don't have enough adequate fiber in there, so we might have to add some fiber in there to help you out with that. But definitely, if you have diarrhea for more than 48 to 72 hours, call your doctor. Constipation, the other end of the spectrum that can happen, and this too can be if you don't have enough water, fluids. But most people, and also your medications can really cause constipation. So working with myself or the nurse, letting us know that's happening so we can get you on a bowel care program. Last is vomiting, and hopefully if this happens, you need to stop the feeding right away and call your doctor. So if something's going on, if you maybe not tolerating it at all, we don't want you to keep giving yourself feeding. And dehydration can happen too if you're not giving yourself adequate those water sandwiches, because you're getting fluids that way as well. Abdominal discomfort, that can happen, but if it's becoming so uncomfortable, again, it's cramping, call your doctor. And last, tube clogging can happen. Never put anything down your tube. I've heard of people putting hangers down to get the clog out. But just all you can do is keep putting with the syringe, and this is where you might want to use the plunger a little bit more just to get a little bit more force, but not too much. You can just keep putting in water through there and just gently, gently keep trying. And if it's still clogged, you need to call the nurse. And they'll have some ideas too. The last, page 23, has all the reasons to call your doctor. I think those are really good to go over. We went through diarrhea, constipation, nausea, vomiting. But you always get weighed every time you come in, but that's a really good, if you're losing more than 2 pounds a week, that's a good indication that maybe you're not getting enough in of your formula. And then the very last page is also really nice to keep a diary, because when you meet with the dietitian, I will be asking you, I'll be looking at your weight, but I want to know exactly how much formula you've taken, how much water you've taken, and any other fluid that you've put through your tube, and also about your bowels. I want to know about that too.
Question for you, Jenny Kraus, RD, about constipation. How would you define constipation? Some people have different ideas.
That's a good tip. So more than 4 days is kind of the
4 days, no bowel movement, constipation.
Absolutely.
But one hard stool, no.
Yeah, even though it's still considered, I mean, it's still difficult, but I would tell me or the nurse about it
Okay.
in any event. But yeah, that's the definition.
Mm-hmm.
And then also I did want to I've learned this along the way, so I'm just telling anybody else who's watching this, is people who have leaks around their PEG site, I always ask them how their bowel movements are, because I've noticed if they're constipated, they're really pushing, and that pressure pushes out bowel gastric juices. So, and same thing if they cough a lot.
Okay.
People sometimes after chemo find like they're having that nausea and that gagging. Yeah.
Okay.
So that I never realized that until it makes sense though.
And Jenny, also on the equipment, I noticed another side port. Tell us about what that is, and should the patient touch that?
Okay.
What is that for?
So you know what? I haven't seen this one on a lot of them, and the ones that Dr. Rids and True use don't have this one. But if you did have this one in, this is it decreases the air. You can let some air out, like if your stomach was really bloated. And then this one is for medications. But I've only seen them doing the one.
The one. Okay, so we should not see that. That's just the demo thing.
Yeah.
Okay.
It's the demo one.
Okay.
But I hope I went over that well enough.
And really, as long as the RN or RD that follows after you just go over every page with the patient. Each of us have a book, and that helps cover it.
I think so.
Okay.
Yeah.
Okay.
To me, the part that's going to be, which has been the issue the whole time, is making sure it flows through as far as the information from home infusion to the doctor and to the.
And I'll be on that. Well, thank you, Jessica, and thank you, Jenny. And this has been a wonderful video time here today. Thank you both.